We are going to talk today one very much important subject on the spine, and that is the failed back surgery. You need to remember that we have some study that we discussed before that around 2 or 3 years ago, 760,000 people were operated on back surgery. Around 60% of the people had fusion. Last year, 8 million people had surgery. I don't have the information how many of those ones were fusion, but this is becoming like an epidemic. Spine surgery are becoming one of the most important sick type of situations in medicine, and we need to have some answers. And more surgery we do, more complications we have. And if we continue doing fusions, we will have an enormous disaster in people that they are going to be operated. So let's talk about failed back surgery. Well, one of the problems with failed back surgery is the diagnosis. What is really failed back surgery? Failed back surgery is when you had surgery and you expect to have immediately some sort of a relief of the pain that you have, and then go back to normal activities and normal life. The reality is that when you have back surgery, and if a procedure was done with an open surgery, and a fusion was also done, the results are totally different than what is in your mind. You are going to have several months of recovery, and you are going to have rehabilitation, and you are going to have pain management, and you are also have a possibilities to have more surgery. So physical therapy will be one of the first things that they are going to be directed to remove some of the post-operative pain. The amount of money that we spend in rehabilitation, physical therapy, chiropractor treatments, pain management, drugs, and lack of work situation for that patient are staggering expensive. So they are on billions what the country and the insurance company spend to be able to maintain those patients in some type of recovery. Now, the problem that we have with this is still these surgeries are not at the level that we should be recovering these people. So the situation that happens is 65% of the fusion surgery fail in 2 years if it is one level of fusion. If it is 2 levels or more, and usually the most frequent level is 3 levels of fusion, that is around 80% of the fusion fail in 2 years. So you start to get better when the instrumentation start to fail, and you start to have again medical problems that they require 2 things, or further therapy, further medical treatment, further drugs, or more surgery. So why we continue doing these procedures? They are so ineffective? I don't know. I don't know if it is because we don't have any other procedure that can address this problem. But failed back surgery is a result of a bad surgery. Not because surgeon is doing a bad surgery, it's because the technique, the situation that you put this patient into fails. And that failure repercutes in family problems, in economical problems, in social problems, psychological problems, medical problems or depression. All this becomes in effect because of these surgeries are not at the level that we should offer to a patient. Sometimes the patient is better without the surgery. Now, at the Bonati Institute, we were initially doing also open surgeries. But then we realized that the results were not at the level that we expect. And with the help of arthroscopic surgery, we were able to create techniques here that allowed patients to recover almost immediately. So back pain is not the problem for us. It's a problem for the world. A tremendous amount of studies are about back pain, and it's because that forced the surgeons to do surgery. If it is back pain with radiculopathy, a surgery is advised. Back pain by itself, they're being treated with different things. Some of the elements of the treatment are placebo studies. Some of the treatments are treatment that they require that the patient will have some electrical device implanted. Some of the situations will require that the patient have a fusion. All these elements are because the failed back surgery create a tremendous amount of situations that are not addressed properly for years. So at the Bonati Institute we have techniques today that we can recover the patients in less than 2 weeks. So it's important to understand that these procedures are being done in a serial of small treatments. Each procedure takes an hour and usually are 3 surgeries or 4 surgeries, sometimes more if we need to take the screws and plates to allow the surgeon to get exactly on the area where the nerve is being injured. So back surgery and problems associated with failed back surgery are a tremendous amount of problems and tremendous expenses for society today. Insurance companies, government, money coming from the patients are being wasted in these types of treatments because they are ineffective and they need to have some changes. And the changes is understand the pathology and attack the pathology, and don't start to think that you are going to fuse something and that is going to correct the problem. The fusion is not going to correct the problem. And in 2 years, you're going to have massive problems. So if you want to know more about, get in touch with the Bonati Institute people. They are going to discuss with you your problem and see if that is something that you are pursuing to treat. Mostly failed back surgery or back pain by itself. Thank you.